Position the circumferential dynamic retainer or CDR around the patient's torso, centered on the spine, leaving a free end on each side of the patient. Position the rectus muscle splint RMS approximately 2 centimeters from the fascial edge with the tensioning dial edge adjacent to the fascial defect and parallel to it, with the outer edge aligned with the anterior axillary line. A protective skin layer may be used under the rectus muscle splint if desired. Open the crossbar to allow insertion of the CDR into the opening between the crossbar and RMS. Feed the CDR through the opening on both sides of the fascial defect. Grasp the leading edge of the CDR and apply tension by pulling firmly until resistance is met while maintaining both RMS in the correct position. Fold the CDR back posterolaterally and gently push it against the locking strip's hook and loop system to secure it in place. On both sides, push the locking buttons down into their mated slots in the RMS until they click into place. Confirm proper placement and parallel alignment of the RMS approximately 2 centimeters from the fascial edge. Ensure the tensioner gauge system is reading, at rest and without any external pressure on it, in the blue range. If it is not in the blue range, please follow the steps in the instructions for use guide for adjusting the resting tensioner gauge before continuing. Then place the tensioner gauge system's balloon section down the center of the fascial defect in parallel with the RMSs. Ensure the tensioner gauge system isn't interfering with any TAC or temporary abdominal coverage device covering the fascial defect. Simultaneously advance both RMS devices towards the fascial defect, creating tension on the CDR. Maintain each RMS parallel to the fascial defect edge and approximately 2 centimeters, a thumb's width, from it. While holding the RMS securely in position, pull up on the most proximal tensioning dial, releasing the tensioner for extraction. Pull the tensioner across the fascial defect and position it in the corresponding cleat on the opposite RMS. Push down on the tensioning dial to engage it and rotate clockwise to wind the tensioner until taut. Repeat the same process on the lowermost tensioning dial, then continue alternating top and bottom for the remaining dials. In unison, tension both sides equally while maintaining parallel alignment with the fascial defect. Ensure that each tensioner tab remains secure in its cleat. Apply tension equally until the gauge on the tensioner gauge system reads in the green zone. Fluctuation is expected with patient's respiratory movements. The gauge reading should stay in the green zone on patient exhale. If the gauge reading exceeds the green zone and enters the red zone, gradually loosen the tensioners equally by pulling up on the tensioning dial to release them until the gauge returns to the green zone. Ensure the tensioning dials are pushed down and engaged after returning to the green zone. Retensioning of the dials may be required. Note that the sequence of tensioner installation and tightening should keep the RMS parallel. Inspect the RMS for tautness, placement, parallel position, and distance from the fascial defect. Velcro tensioner gauge to the CDR for safe placement. Place gauze protection underneath the tensioners to prevent damage to the temporary abdominal coverage material, ensuring that the gauze protection does not interfere with the tensioner gauge reading. Monitor the tension gauge to ensure the gauge is in the green zone. If the gauge is in the red zone, decrease the tension. If the gauge is below the green zone, increase the tension by equally tensioning the RMS with the tensioning dials. Note that the sequence of tensioner installation and tightening should keep the RMS parallel. Reassess AbClo RMS placement and tension per institutional protocols for intra-abdominal pressure. AbClo is designed to perform gradual approximation of the fascial defect. Therefore, Complete fascial reapproximation from the outset should be avoided. Given that lateral fascial retraction occurs in as early as 3 days, best results with the AbClo are obtained with early application. Apply the AbClo early, the sooner the better. AbClo may be used with any temporary abdominal closure device and is always placed on top of the temporary abdominal coverage material with or without negative pressure wound therapy. Do not use AbClo over unprotected viscera.